into our main session for the day with Elingah Magada, and on the topic managing the COVID-19 infodemic in the workplace. And Elingah Magada is going to take us through. She's our guest presenter for that one. Elingah is an occupational safety and health practitioner with over 11 experience in the occupational safety and health regulatory industry, and she has qualifications including the NEBOSH, a master's degree in strategic management, and a bachelor's degree in health education and promotion. So she's the one who's going to lead us through this subject on how we can manage the COVID-19 infodemic in our workplace. So let's take this opportunity, relax, and listen to what she's going to share so that we can put in our thoughts on this subject. Thank you, Elingah. You can take the opportunity.
Yes, good morning, Teacher Ona.
Morning, how are you? You are welcome, and the floor is yours.
All right, thank you very much. I'd like to take this opportunity to thank ESH15 for the platform, and I would also like to thank everyone else who's joining us as we are going to be talking about managing the COVID-19 infodemic in the workplace. Maybe let me hasten to say that I'm not going to be presenting as an authority on this issue, but rather this is meant to facilitate a discussion or to stimulate a discussion and action on managing the infodemic within the workplace or within the occupational safety and health space, because we find that the infodemic issues to do with the infodemic have been quite topical in the public health arena. But from my research with regards to occupational safety and health, I haven't really come across any information that pertains to this particular issue. So I felt that maybe it needed to get equal attention from an occupational safety and health perspective, because of the obvious impact that this infodemic has, not only on public health interventions on the pandemic, but also on occupational safety and health interventions on the pandemic. So, especially in light of the high vaccine resistance or hesitancy that has been that a lot of countries as well as organizations have been experiencing. I don't know in other countries, but here in Zimbabwe, you find that a lot of organizations have been trying to promote vaccination among their employees as part of their return to work strategies. But there's been a lot of resistance from workers due in part to the misinformation or the myths and misconceptions that have been surrounding the issue of vaccination. So this is basically what led me really to reflect on this issue of the infodemic and maybe to research on it more to see if there are any workplace interventions that are meant to address the issue of the infodemic. And to start off, I think it's important for us to reflect on that statement which was made by the Director General of the World Health Organization, Mr. Tedros Adhanom Ghebreyesus. I hope I managed to pronounce that correctly, where he indicated that we are not just fighting an epidemic, but we are fighting an infodemic, and fake news spreads faster and more easily than this COVID-19 and is just as dangerous. So you find that putting it in the context of occupational safety and health, I understand a lot of organizations have put in place control measures to manage this risk within the workplace. But there's also another twin risk that has been related to this pandemic. I say twin risk because you find that it's an underlying risk that has been associated with the pandemic and which is just as equally dangerous and can have an effect on workplace strategies to manage the COVID-19 risk. So this is why we are saying that statement that was made by the Director General of the World Health Organization, where he indicated that we are not just fighting the epidemic or the pandemic, but we are fighting an infodemic, and that fake news spreads faster and more easily than this coronavirus and is just as dangerous. So to put it in the perspective of occupational safety and health, we are trying to say that I understand that a lot of organizations have put in place control mechanisms to manage this pandemic, but there's also been that general oversight of the other twin risk that has been associated with this pandemic, which is the infodemic, or the information crisis, or the information epidemic that has been associated with this pandemic, which is just as dangerous and which can really affect the impact of whatever control measures on COVID-19 that we can institute at organizational level. So I think it's high time that as organizations, we need to consider this as an equally important risk within the workplace environment. And maybe just to put things into perspective, it's important for us to define what an infodemic is. The term itself is fairly new, though the phenomenon is not. It first appeared in 2003 in the Washington Post and is generally ascribed to a gentleman by the name of David Rothkopf, who is a journalist and political scientist, and he's the one who started using this term called the infodemic in relation to the SARS virus outbreak, which had occurred during that time. So I find that this term is a fusion of two words, which is information, where we are looking at data, and epidemic, where we are looking at a health crisis that spreads rapidly over a large population within a short space of time. So if you fuse the two words, now we are now saying that in this case, it becomes an information crisis that is spreading rapidly over a large population within a short space of time. And this infodemic can be defined as an overload of information, some of which is accurate and some of which is not, which makes it hard for people to find trustworthy sources and reliable guidance when they need it. So this often leads to misinformation, where we are saying that because of this overabundance of information, people end up unintentionally spreading information that is inaccurate because, one, they believe that that information is true or reliable, and two, they are not even aware that they are spreading that unreliable information, and they are not aware of its impact not only on themselves but on the people that they'll be spreading that information to. And it also leads to disinformation, where in this case it's intentional spreading of inaccurate information for nefarious intentions. For example, we might have certain opportunists who take advantage of this situation to peddle false cures of the COVID-19, where they say that I've got a cure for COVID-19 for maybe financial gain or for monetary gain. Or this disinformation can be spread for purposes of espionage, where organizations or groups of people or countries intentionally spread false information about the other group or the other country or the other organization in order to discredit it. So you find that these are some of the dangers that are associated with the infodemic, and generally it then creates a lot of confusion and increases anxiety and panic in the public, as well as mistrust, and subsequently affects the public's response to certain public health interventions that will be meant to curb the impact of this virus. So you find that there are several factors that actually lead to this infodemic. One, we've got information voids or rapid information changes with regards to the pandemic. For example, when this virus started in 2019, it was considered the novel virus. I don't know if we can still consider it novel, But when it started, there were a lot of information gaps regarding its general pathogenesis. Not much information was known, and that gave room for conspiracy theorists as well as religious leaders to come up with alternative explanations or theories or rumors or speculations that were tied to this pandemic. It can also result from rapid information changes, like I indicated earlier, and taking it in the context of COVID-19, we are saying that, again, there have been various changes in information, which may be due in part to the highly mutative nature of the coronavirus, which has really impacted on the information that we've been getting. For example, when we started, we were told that, the basic symptoms that were associated with the COVID-19 virus were fever, dry throat, cough, and whatever. But because there have been various mutations, you find that the disease, or the virus rather, has been presenting itself in different forms. Even its pathogenesis has generally changed. So you find that these information voids and changes, they sort of create panic in the public, and people end up trying to seek answers, and then we have some conspiracy theorists or some opportunists, whether they are conspiracy theorists or religious proponents, who end up coming up with alternative explanations that then the public latch on and take as truth with regards to the pandemic. Then another significant driver of this pandemic is general distrust in authorities, whether it's public health authorities or it's governments, which is probably triggered maybe by certain historical events. For example, we've had the Tuskegee syphilis study, for those of you who are aware of it, where a study was carried out in the 40s among black men that were infected with syphilis, and these men were deliberately misled into believing that they were being cured of bad blood. They were not informed that they had syphilis, and they were misled into believing that they were being cured for a different condition, which is bad blood, because authorities wanted to study the natural progression of syphilis if it's left untreated. So we have such historical cases that can really impact on the public's trust on authorities. Then recently, when the vaccine was developed, I remember watching somewhere a video of a mercenary who was saying that he had been tasked by a certain government they were part of a certain a project by a certain government to deliberately inject black men with the HIV virus. So you find that it's such historical incidences that really build general distrust in authorities, whether they are governments or they are public health authorities, and which then impacts on the infodemic, because you find that if public health authorities or if the government establishes a certain public health intervention that is meant to curb the pandemic, the public will not easily trust that intervention, because they'll be thinking of past historical events that have happened, and they'll be thinking that maybe it's a hidden agenda by that authority or by that government to maybe, I don't know, achieve other agendas. Then we also have digitization as well, which has been a significant driver of this infodemic, where we are saying that due to the increase in use of social media, of the internet, it has really become very easy for anyone to just generate their information on the pandemic, upload it on the internet, and disseminate it to billions of people around the world in a matter of seconds. So we find that because of digitization, this particular infodemic that is related to COVID-19 has probably been one of the most challenging. Though earlier on I mentioned that it's not the first time that we've had an infodemic. This is not a new phenomenon. If you reflect back, we've had pandemics like HIV. We still have them. There have been certain misinformation and disinformation that has been associated with that pandemic. But you find that that misinformation has tended to be localized because there was no widespread use of digital platforms. I can give an example of some of the misinformation that used to circulate, for example, to say that if you sleep with a virgin, you get cured of HIV. These are some of the misinformation and disinformation that was circulating, but it tended to be localized to certain countries, like here in Southern Africa. It became quite a trend where people would intentionally sleep with virgins in the belief that they would get cured of HIV. But if you went maybe to other countries, or if you go to other countries, they're probably not aware of this because information did not travel as easily as it does now. And maybe to add further to this, the isolation that has come from the lockdowns has also increased people's use of media, any form of media, whether it's physical or digital, to seek answers or information which pertains to the pandemic. So with all this various information, this mixed information, all these conspiracy theories and all these rumors and speculations surrounding the pandemic, you find that it's already finding a ready audience in those people that are seeking answers. So I find that all these factors really have an impact on the pandemic. So we now want to look at the impact of this pandemic on workplace strategies on COVID-19 or workplace control measures against COVID-19. One, it affects decision making and crisis management, because we are saying that there's a lot of information, a lot of mixed information that is circulating, some of which is factual and some of which is not. So because of that amount of information, it makes it difficult for organizations to filter truth or facts from fiction, and which may really delay decision making in their response to a crisis. For example, if you remember, sometime last year, early last year, when this pandemic was starting to spread, a lot of governments pushed for economic lockdowns. You find that, well, despite the known risk of this pandemic, very few organizations were able to act and had to wait for governments to impose economic lockdowns so that we minimize the amount of physical contact among people, so that we halt the spread of this pandemic. So I find that in such a scenario, had governments not taken a position, maybe organizations would not really have taken an active position to say, let's decongest our offices, let's use remote working strategies as part of managing this pandemic, because they didn't really have any solid information to base their decision on. So ultimately, it affected that decision making and their crisis response to the pandemic. You find that this infodemic also affects workers' confidence in public health interventions. I think this speaks to the other points that I've raised previously, that because of the various conspiracy theories, the various religious theories that have been forwarded with regards to the pandemic, that generally reduces workers' confidence in public health interventions. And it's one of the reasons why organizations are currently facing high vaccine resistance or hesitancy among their employees. This infodemic also alters health seeking behaviors. And here we are saying that it can actually delay health seeking behavior, as people may be when someone is infected by the virus, they seek alternative remedies that are not scientific, but because they've been circulating in the information space, they would rather go for those alternative remedies before they seek professional medical help in relation to the COVID-19 virus. So I find that because of that, we've had a lot of fatalities or people dying because they delayed in seeking professional medical help in relation to this COVID-19. Then it also increases at-risk behavior or unsafe behaviors in relation to COVID-19. We've had certain misconceptions or myths that have been circulated that if you drink alcohol or if you drink sanitizer or if you drink ethanol, you can get, it actually protects you from the risk of the COVID-19 the coronavirus. So I find that because of that, we might have certain workers actually abusing maybe alcohol in the workplace because they have this belief that it can cure them or it can protect them from the risk of COVID-19. And what makes it worse is that of late, most organizations have suspended or temporarily suspended the use of breathalyzers as part of their alcohol detection or alcohol screening program before workers start work. So because of that, you find that those workers end up engaging in at-risk behaviors that may actually present not only the risk of the COVID-19 itself, but that intoxication can present with other unsafe or at risk. It can also present with other unsafe behaviors where someone ends up performing work while they are intoxicated, that's presenting a danger not only to themselves but to other people that they'll be working with. I've also seen certain studies that have indicated that if you take marijuana or if you smoke marijuana, it can actually cure you of COVID-19. So you might have workers who start abusing that marijuana in the hope that maybe to protect them against COVID-19. Then we are also saying that this infodemic can also trigger panic and anxiety, especially with some of the conspiracy theories that tend to give a gloomy outlook to this pandemic, to say, it's one of the indications that the world is coming to an end, or it's an elitist agenda to eliminate population or to control populations. So because of such misinformation or such conspiracy theories, it tends to trigger panic and anxiety in the population, which can result in elevated levels of stress or mental health problems among workers in organizations. Then finally, we are saying that it also promotes stigma and discrimination or social discord in the workplace. I'd like to believe that some of you have read of instances where workers of Asian orientation or Asian descent have been discriminated against because of the general belief that this disease started in the Asian countries. So you find that these are some of the effects of the infodemic in the workplace that can really affect how we then respond to the COVID-19 risk in the workplace environment. So we also want to look at current public health strategies that have been implemented to manage this infodemic. There have been several strategies, some of which include the provision of timely and accurate information, as well as training and awareness on COVID-19. We've got examples such as the World Health Organization Information Network and Epidemics, which has really tried to give timeous and accurate information to people with regards to COVID-19, so that it tries to cover those information voids that we talked about earlier, that we said can lead to the infodemic. Then there's also the development of global resources for fact-checking and misinformation, again, which is being spearheaded by the World Health Organization, which is the highest authority on public health matters. So they've been developing these global resources in collaboration with other organizations such as the AFP Digital Verification Service, which is generally a fact-checking organization which looks at the different media sources to check if the information that they are churning out with regards to COVID-19 is factual, to check if it's accurate, to check if it's correct. The World Health Organization has also been doing an infodemic measurement and analysis just to check the impact of this infodemic, how much false information has been circulating out there, and how many people have been accessing, and they've been doing this through the various internet platforms as well as the social media platforms. They're also into evidence synthesis, knowledge translation, risk communication, community engagement, and amplification of messages. So really, the World Health Organization has been working in overdrive to come up with global resources to address this issue of infodemics. And if you Google some of the strategies that they've come up with that are meant to address this issue of the infodemic, you find that there are a lot of strategies that they've documented and that they've recommended governments and local public health authorities to implement at country level. Then it's also active in publishing Mythbusters, as well as conducting live question and answer sessions with experts. I'm sure whenever you go on Google and you try to Google anything with COVID-19, the first few sites that appear are usually Google usually World Health Organization websites that publish or that address some of the myths and misconceptions that are attached to COVID-19. They've also conducted live question and answer sessions on various social media platforms and internet platforms where they interview experts on the pandemic so that they try to churn out as much accurate information as possible to people. Then they've also collaborated with digital search and social media companies to try and filter out false information. I'm sure you've noticed that with some of these social media platforms like Facebook, like Twitter, and all the other social media platforms, whenever you talk of COVID-19 or whenever you type the word COVID-19, your message is immediately flagged. Or they can block out certain information that is related to COVID-19 that they might feel might actually be inaccurate and might lead to misinformation and disinformation with regards to COVID-19. They've also used influencers as well to spread factual messages through the various social media platforms such as Instagram, such as YouTube, so that these influencers try to send as much factual information with regards to COVID-19 as possible. But however, despite these public health interventions, there's been a call by the World Health Organization to say that we need to have a collaborative efforts in order to really strengthen the fight against this infodemic. So this is why we are saying that this is now an issue that needs to come to the organizational level, because we are saying that the organization is not only a significant driver of the pandemic, but it can also be used as a tool to manage the issue of this infodemic. So we now want to look at some of the strategies that organization can employ to manage the infodemic. They can identify and use authentic sources of information. I've seen or observed that quite a number of organizations have been taking an active role in trying to train their employees, as well as generate posters in relation to this pandemic. So I find that in the process of training or using those posters, organizations need to make use of authentic sources of information or authoritative sources of information, or to refer to authentic or authoritative sources of information. I'm sure you've noticed that throughout my presentation, I've been quoting the World Health Organization. That's one example of using or identifying and using authentic sources of information. Avoid a situation where you want to sound as if you are the originator of that information, or where you use other unverified sources of information. You know, like I said, information, it's now easy to get. It's available at the click of a button. Anyone can just log in and get information from any unverified source, and then start peddling that as Bible truth, which then misleads employees. So as organizations, we really need to identify and use authoritative sources of information on the pandemic. Then it's also important to intensify risk communication. Here we are saying that let's try to communicate frequently if there are any changes that have been conveyed by an authoritative source such as the World Health Organization or the local public health authority with regards to the pandemic. Let's try to communicate that in real time, so that people or workers are kept abreast of the latest developments in terms of this pandemic. And so that we also avoid a situation where we create those information gaps or voids that then force workers to go and look for their own information from unverified sources, leading to misinformation with regards to COVID-19. Then it's also important for management to role model certain interventions. For example, this issue of vaccination that we are talking about, it can only be effective within the workplace if leadership take a step or lead in the vaccination drive. I've seen quite a number of organizations that actually publicize events where their top management is being vaccinated. So that, in a way, sort of fights that misinformation or disinformation that will be generally surrounding the issue of vaccination. Then it's also important to promote and maintain worker engagement in all the strategies that we'll be using, because we're saying that these strategies are meant to address the infodemic and its impact on among workers and their response to workplace interventions to the pandemic. So we are saying that whatever interventions that we employ as an organization, let's try to engage their workers. Let's hear their views. Let's hear any misgivings that they might be having in relation to certain interventions that are meant to address COVID-19 within the workplace, and then address those concerns or misgivings appropriately. It's also important to direct workers to authoritative sources of information when maybe workers feel that they need to look for information with regards to COVID-19 on their own. I think it's also very important as an organization to direct workers to authoritative sources of information. And by authoritative sources, we are looking at, they can be human sources. We are looking at your medical professionals, your doctors, your nurses, whom we believe are the authoritative sources with regards to COVID-19, or they can be digital sources or physical sources. Digital sources, we are looking at the various websites that employees can log on to in order to look for accurate information on the pandemic. Or they can be physical sources such as books or publications that have been made by authoritative organizations with regards to COVID-19. It's also important to empower workers with health and digital literacy so that they're able to make sense of some of the information or some of the misinformation that may be circulating. Maybe just to give an example, which may not really be related to COVID-19, that talks of health literacy. I don't know if this problem is common in other countries, but in Zimbabwe, we've had a challenge with workers who work in dusty occupations who often demand milk from their employers because traditionally the practice was workers in dusty occupations would be given milk because the belief was that that milk had preventive or protective properties against the effects of dust. But you find that once you start explaining the health aspects or the biological aspects of this argument, workers begin to make sense of the fact that milk doesn't really work as a protective or a preventive measure against the effects of dust, because we are saying when you drink milk, it goes to the stomach, yet dust affects the lungs. So you find that such health literacy can actually help workers to filter some of the information that they'll be getting with regards to COVID-19. They can easily dismiss to say, well, this doesn't make sense. It doesn't make biological sense. Then by digital literacy, we are saying that it's important to educate workers or to train workers to be able to identify authoritative digital sources of information, to be able to identify or to filter counterfeit, maybe websites that may be peddling misinformation that is related to COVID-19. Then finally, it is also important to build worker resilience to misinformation and disinformation. Let's try to educate our workers that it's important for them to break this chain of misinformation where they just send or forward any message that is related to COVID-19 within their social media groups. The practice now, or there's been a tendency, maybe because of panic and anxiety, there's been a tendency that as human beings, we are now just circulating whatever information comes our way, because we have this mentality that you never know what could save the next person. At one time, I remember receiving a message that was highlighting that someone drank bleach. I think I mentioned this issue earlier, where someone was making a claim that they had contracted COVID-19 and they drank bleach and got cured of that. So this is some of the information that will be circulating, and we ended up laughing it off with my friend. Just looking at it, it didn't really make sense to say, I put my health at drinking bleach in order to protect myself from COVID-19. But you find that this is a message that had been circulated by another person. So you find that we need to train our workers to break that cycle of just spreading any information that they would have received that is related to COVID-19, and information that may not really be accurate or that may be unverified. So these are some of the strategies really that we can employ at organizational level as we manage our COVID-19 risk. Let's also take note of the underlying impact of this infodemic on workplace strategies on COVID-19, and maybe try and address it accordingly. You find that my list is not exhaustive. Like I said, I'm not speaking as an authority, but I'm just here to stimulate this discussion so that we really try and contextualize it within the occupational safety and health space, and maybe identify other ways that we can address this issue of the infodemic within the workplace environment. On that note, that brings me to the end of my presentation. I don't know if there are any questions or contributions with regards to this presentation. Thank you.
Thank you, Elingah, Magada, for that insightful presentation. Okay, I can see the hand up from Sia Makai. You can come up here.
Thank you. I think it was a very informative presentation. We appreciate it. The question I have isn't addressed to the speaker only necessarily, but taking this word of misinformation and raising a question, what do we do when we find scientists, medical experts, even pandemic experts themselves saying or telling the world that vaccinations are not going to work or they are not the right thing to do? I found it difficult for a general man on the street or woman on the street to decide what is misinformation and what is the truth, because you find people who are scientists themselves debunking the use or the efficacy of the vaccinations against COVID, for example. What is the general view? What should we be doing out there?
Okay, Mr. Sia is asking what should be done to make people at any level decide what is misinformation and what is factual information, especially when it is now coming from some of the people who are believed to be authentic in this with these issues. I don't know if anyone can take up on that to answer Mr. Makai.
Okay, maybe I can come in to address that issue. Of course, I'd like to concur that we have had prominent public health figures or other authorities that have discredited these vaccines. But I think it's always safe to refer to the highest authority on public health matters to find out what their position is with regards to certain information. Like the example that I gave, that in my presentation I was making constant reference to the World Health Organization because, you know, globally it's considered the highest authority on public health matters. So in such a scenario, I think this is where we're talking about digital literacy, to say that we try and direct workers or the general men on the street to these authoritative sources instead of directing them to an individual or a particular expert or someone who's deemed to be an expert. So I think with the case of COVID-19, really, let's try and always make reference to the World Health Organization and what its position will be regarding this COVID-19. I don't know, that is my view, subject to maybe correction by or other views from the attendants.
Okay, thank you, Elingah. I hope Sia you have been answered on that one.
Thank you. So we should refer to the WHO, basically, the global official organization. Thank you.
Okay. Is there anyone with another view? Okay. This issue of infodemic is actually issue, especially in the workplace as well as at our homes. It's actually hilarious that during the old days, when we were young in primary school, we would just be told the immunization of a certain disease, the vaccination of certain disease, and people would just come to schools or any point of vaccination, they would just join the queues without questioning. But now with this digitization is highlighted by Elingah, we are finding now more people are being skeptical about the immunization, about their public their health, and that's where it becomes a challenge for us, especially with the professional health and safety, to promote issues as vaccination in our workplaces, because now people have different views besides their religious inclination. Before, it was only those people who have different religious inclination who were causing certain challenges in vaccinations and immunization. But now it's more, the numbers have increased, and more people, even because of this information they are getting, they are now more skeptical. And I would like to also endorse a point that was highlighted by Elingah on how we can manage and control infodemic, where she says let's ensure that we build resilience amongst our workers, amongst our employees on misinformation. I've seen that one working. There's a certain group I am in, and when this COVID whole thing started off, people would just post different, so many chain messages in those groups. But there was now a certain point when you post anything or any chain message in the group, people would ask you, where did you get that? Did you verify it? Is it authentic? And most people who would fail to ask questions, you would now see them refraining from just posting certain and different messages in the groups. So that certain resilience can promote people to deal with misinformation in our groups as well as our workplaces. Fungai, your hand was up and you wanted to say something?
Thank you, Teach. Thank you, Elingah, for that presentation. It's obviously a burning topic and an ongoing one that I don't think with technology and the different platforms like WhatsApp and Facebook and the like, it will stop anytime soon. But I think just reverting back to the workplace, the biggest challenges for practitioners and their colleagues is that, as you mentioned, the different information comes from different directions and different sources. Everyone has got a relative, and somehow during these periods, we all become experts in our own right based on information we're getting. And I would suggest that for workplaces, and I'll be curious to hear what others have done in their workplaces, but running awareness campaigns whereby, even if it means bringing in health practitioners, like from the insurance companies, have been dispatching their officers to go to different workplaces that are their members to educate workers on whether it be vaccination or COVID-19 and the like. And I guess it's slowly becoming to a point whereby, vaccinations are almost becoming mandated, and true to form, that inconvenience of not being vaccinated is starting to be glaringly obvious. So I'd suggest that awareness campaigns be done, probably more frequently within the safety meetings and the like within the workplace. And if need be, practitioners should be brought in from outside to present. Thank you. But yeah, I'm interested to hear what others have done in their workplaces. Thanks.
Thank you, Fungai, for that contribution. He is saying that let's promote our awareness campaigns in our workplaces, and let's ensure everyone is educated on issues of like digital literacy, like what Elingah said. Those things, they have to be shared with the employees, and people have to gain more knowledge about certain issues so that we can manage infodemic in our workplaces. Okay, I guess not. Thank you, Elingah, for that insightful presentation, and thanks to all who have contributed to this discussion. And I would like to think that everyone has been educated on this, and we are also going to take up this information and share it with people who are in our circle, like we always do with the COVID-19 chain messages. Let's say share this message also to our networks and promote resilient public health within our organization. Okay, I think this brings us to the end of our session. So before closing, I'm going to launch a poll survey that is in relation to this subject. as I'll be making a few announcements. So thank you, Elingah, thank you everyone.
All right, thank you.
So like I said, our post has been anonymity is guaranteed. So you are free to share your opinions on the different questions. Your name won't be tagged to any responses that you are going to give.
Like I highlighted earlier at the beginning of the session, that we are going to make a few announcements towards the end. But before I jump into that, I would just to take this opportunity to once again thank our guest presenters, Tapwana Shichko, for a spotlight presentation that he gave us, as well as Elingah Magada, who presented on managing the COVID-19 infodemic in the workplace. Thank you guys, and all those who partake in these discussions. Would like to appreciate your contribution, and everyone who attended this session. I guess everyone has learned one or a few things that we are going to implement in our day-to-day lifestyles, at home, at work, and everywhere we are. Thank you. So for our next session, next Friday, that is on the 10th of September, we are having a session entitled The Rise of Fossil Fuels Consumption in Africa. And for that, we have a guest presenter, Mr. Robert Mandeya. He's the one who's going to take us through this discussion. So let's ensure we join in and we don't miss out on this session. Our September magazine is going to focus it is going to run under the theme Sustainable Energy Symposium in Africa. Hence, the discussion that we are going to have next week with Mr. Mandeya. It's promoting that theme. And for those who may want to partake in our webinar e-learning sessions, or who may want to contribute with a topic or with a presentation, you are free to contact us on our guest esh.africa. And for those who may want to partake in our magazine with articles or any stories they may want to share, you are also free to contact us on marketing@esh.africa. And anyone who may want to contact us on any issues, you can get in touch with us on social media, Facebook, LinkedIn. Also, look at us on our webpage, that is esh.africa. I think that is it for the announcement. Our August magazine has been published, and let's ensure everyone will get their copy. It's available as well on all our social media platforms, as well as our webpage. Let's ensure we download and share with our people in our network. I would like to take this opportunity to thank everyone for participating in this session, and I would like to say see you next time. It's now time for our group photo. Let's turn on our camera so that we can take up our group photo. Thank you.